Hello, how are we? Welcome to Louis Foundation once more. And today we are dealing with the management of a life-threatening condition. They are conditions whereby if we do not intervene, the patient is going to die. An example of these conditions we are going to give are the likes of asthma. Asthma, whenever the patient comes to the hospital, they are under attack. So if we do not intervene, if we do not resuscitate, the patient is going to die. The other condition we are going to give is diabetes ketoacidosis, which is a complication of diabetes mellitus. It is an emergency that we have to resuscitate. The other example I'm going to give is sickle cell anemia. Sickle cell anemia is an emergency we have to resuscitate because when the patient comes to the hospital, they are having a sickle cell crisis. Okay, so this is how we are going to write the management for life-threatening conditions. We are going to start with the M's as usual, and when we are dealing with a life-threatening condition, the M number one is always to resuscitate the patient. Okay, because this patient is going to die if we do not resuscitate. Once we resuscitate the patient, the M number two is going to be to promote quick recovery. Okay, when we promote the quick recovery, then we are going to give emotional support. So we are going to say to give emotional support or to give psychological care, or you can say to allay anxiety. Okay, once you do all those, now throughout the care, you are going to be preventing complications. So we are going to say to prevent complications. So when preventing complications, we have to give an example of which complications we are preventing. Okay, so for a life-threatening condition, we have a lot of complications. You can pick any. Okay, so you can say to prevent complications such as you put the complication. Okay, so that is the aim. Then we go into the main management where we are going to say patient resuscitation. Okay, patient resuscitation. And whenever we are resuscitating the patient, we have an acronym that we follow, which is ABCs. Okay, A for airway, B for breathing, C for circulation. So we have to deal with the patient's airway, we deal with their breathing, we deal with their circulation. Okay, that is the resuscitation. So we say patient resuscitation as a main heading, then the subheading you are going to say airway. Okay, and under airway, I have the points running for you on the screen. We are going to put points. I can give an example of one on each. So on airway, we can put the points like I am going to suction. I will suction the presence of any secretions in the airways to ensure the airways are patent. Okay, I will tilt the patient's head sideways in order to allow the free or to allow the secretions to be falling or to be draining in order to make the airway patent. Okay, there's a lot more points that we can add from there. I have more for you running. Don't forget to look on the other side of the screen. Then we go to breathing. The breathing now, we want to ensure after getting rid of the secretions, ensuring that we have the patient's airways patent. Now let us look at the breathing. Is the breathing of the patient okay? So we are going to say, I will observe for the rising and falling of the chest to ensure the patient is breathing. I'm always putting the rationale. Do not forget to include the rationale. Whatever you do in nursing has a reason to why you're doing it, and we are calling that a rationale. I hope we are together. Then the other point you can put on breathing is, I will place the back of my palms on the patient's nostrils to feel for warm air to ensure the patient is breathing. Okay, so there's more points there. I'm quickly going to run through circulation. Okay, so under circulation, we want to ensure, so we've removed the presence of secretions in airway. In breathing, we'll ensure the patient is breathing, and in circulation, we have to ensure now that air they are breathing is reaching to all parts of the body, including the distant extremities. Okay, so that is where we can even cannulate the patient. That is where we are going to administer O2. We are going to put the patient on O2 therapy if the saturation is below 90%. Okay, when we are done with the ABCs, which is the airway, breathing, circulation, we are going to go now into Psychological care. Okay, we deal with the psychological care of the patient. We ensure they are mentally okay, they are mentally stable, so that we can go into our observations. So for psychological care and observations, I'm glad to say that points do marry each other in all the other managements. Okay, when you're done with these two, or rather let me say, when you're done, when you reach some psychological care and observations, it means you are done with the immediate nursing care you're going to do for a patient who is undergoing a condition that you have to resuscitate, or a life-threatening condition. Then you're going to pick anything you want from the general eprophenema. Okay, I hope we are clear. If you have any questions, make sure you ask. The numbers are running through the screen, and you can follow us on our social media platforms: Facebook, WhatsApp channel, YouTube. You are going to find us, Louis Foundation on YouTube, Louis TV on WhatsApp, Louis Foundation. Thank you.